We lost the time not because of the surgery, but because of what they didn't know. So many complications arise not during the surgery, but before, from poor preparation and missed instruction or fear from patients. What if you could work, get prepared, and be confident about your upcoming surgery? Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Nderitu, a family physician. I have an interest in public health and cancer prevention and treatment. In this video, we are going to look at many of us at some point in our lives, we may need to go through an operation for one reason or the other, or a family member may need to have a surgery for one reason or another. We undergo different types of surgery, and we are going to look for you to get the best outcomes from your surgery. How do you prepare for it so that you avoid complications and you are also well prepared for it? So this is what we are going to look at, what your doctor's wishes you knew and the wishes that you had done this. So why do you need to prepare for your upcoming surgery? One is this reduces anxiety. You are well prepared, your mind is set, you know what is happening, and so you are ready for it. Remember that any surgical operation is a new experience if you're especially having it for the first time, so it creates anxiety. So preparing yourself psychologically would be of paramount importance. Then it lowers the risk of infection and the complications. The better you are prepared, especially before the surgery, then you reduce the risk of the surgery. Then it also speeds up recovery. Remember that your body is one. So if you're psychologically prepared, even your physical body will be prepared, and the healing process will take place faster than when you are anxious and you are rushed up. Of course, there are those emergency surgeries that you really don't have time to prepare. But even in those situations, you need some basic information so that you can be psychologically set for it. And then it also helps the surgical team to help you better. So you are not just a patient, but you are part of the surgical team, because as far as the surgery is concerned, you are the most important part of the team. So what do you need to know about your surgery? The first thing is that you need to know what is the procedure that is going to be done to you. At least you need to know what will be done, how do you need to prepare for it, and why is it being done. So that is very important. And then why is it needed? Why do you need this surgery? Are there other options? What complications do you anticipate from the surgery? And then you also need to know what are the risks and the benefits of this surgery. Remember that every surgery has its own complications, its own risks, which range from the operation itself and also the complications of the anesthesia. So ask the doctor to explain to you what is going to be done, and explain it in a language that you really understand. Carry a notebook if you want to take notes, or if you have someone who can do the notes for you, it would be important that he makes the notes for you. So then you also need to know the kind of anesthesia that will be used. Will it be local anesthesia? Will you be fully sedated and anesthetized, or what will happen? So then after this, what is the next step? Then you need to know what are the instructions, what are the do's, what are the don'ts before the surgery. So the doctor wishes that you remember that you stop eating or drinking as advised. Usually most of the surgeries, most of the patients will be advised that 6 to 8 hours before the surgery, you have not taken anything. Unless of course this is an emergency surgery, and then when you have it's an emergency, then the doctor will need to know when was your last meal, so that and what did you take, so that they can see what are the risks that you have of aspiration. Aspiration is sometimes when you are given some of the drugs to make you sleep, then you can start vomiting. And if you are fed, this could be risky and can cause effect to your airway, which could be life-threatening. Then you may be told to stop some certain medications. For example, if you have diabetes, you may need to stop the blood sugar lowering medicine sometime before the surgery, and possibly you may need to use the injectable insulin. If you have been on medications to lower your coagulation levels, what we call the blood thinners, you may need to stop them so that you don't bleed during the surgery. And then you only need to take the medications that your doctor recommends during the morning of the surgery. And then it is important on the day of the surgery, you take a good bath, use an antiseptic soap, and so that this will make sure that you do not have unnecessary microorganisms. And this would make it difficult for your wound to heal and also you to recover from your operation. Then you need to be very clear about some of these things. What kind of anesthesia will be used? Will it be general anesthesia? Will it be local anesthesia? Local anesthesia is where a part of the body is just the part that is anesthetized. And so you may follow what is happening during the surgery. You can talk with the surgical team as the operation is going on. And then there's general anesthesia where you are completely put into sleep, and then you will go through the operations and you will know only what happened after you wake up, and the doctor can explain what happened and what they found out. Then you also need to know how long will the surgery take, so that even your people, when they come, they know at least this surgery will take 3 hours, 2 hours, 6 hours. They are psychologically set. Sometimes it sets a lot of anxiety when a surgical procedure which possibly was supposed to take 1 hour, or the family did not know, they come 3 hours, 4 hours, 6 hours, you are still in intraoperative. So that can cause a lot of anxiety. So then you also need to know after the surgery, what is the approximate time that you need in the hospital. The doctor might not know exactly how long it will take, but they can be able to estimate, like how long do they expect you to stay in the hospital before you are discharged. And then you need to know after the surgery what happens. Do you need a caregiver? How long will you need to be on bed rest? How long will you take before you start moving around? Will you need any aids? Will you need any assistance? All this information you should discuss with your doctor so that you are psychologically set, and you also set your next of kin for all these things, and they know what will be the implications. And then you also need to know what are some of the side effects that you need to watch for, either from the surgery or from the drugs that you will be taking. And this is important. So doctors love patients who ask. It shows that you care about your health and that you want to take charge. So then after that, you need to prepare emotionally and spiritually. So fear is normal. An operation is a new thing, is a scaring thing. You do not know what is going to happen. And so you need to talk to your best friends or the person whom you are confident to, and share your fears, your feelings, your worries, and what are your anticipations. If you pray, it's good to say your prayer. You can do your meditation, or you can write in your journal what are the fears that you have. This will help you release some of the tension that you have. And possibly also you can ask what are some of the things that you want to undertake before the surgery. So ask your doctor or the nurse who is with you, or the person who is with you, who is taking to the theater, what are some of the last minute concerns that you may have. They will be very helpful, and they are always willing to help. Then after this, you need to get your home ready for the recovery, because remember, after the surgery, you are going to go home. So what do you expect to happen at home, and what will be your capacity level after you leave the hospital? So you need to arrange with the meals. If you have kids, you need to arrange for that. If you have course, you have work, you may need to ask for sick leave for some time. All these things should be well set up. Then you may need to set a place where you come and rest after you leave the hospital. You need a bed, the pillows, the chargers, what adjustments do you need to your bed, to your daily activities of living, so that you can always arrange for them. Then you may need supplies like for wood care. What supplies do you need? Do you need pillows? Do you need bandages? Do you need medicines? What do you need? Healing begins at home, so prepare it for it well. So then, what are some of the things that you may need to consider? Surgery is not just what happens at the table, but it is what you do before and after the surgery. And for you to get the best results, these three time periods need to be taken care of about adequately. So, be honest about your health and habits. What drugs have you been using? What drugs are you using? Recreational drugs? Because, for example, if you have been smoking, you take alcohol. Sometimes you may go through the surgery, and because of that time, you may not be able to access some of these things that you use. You may go into withdrawal symptoms. Your doctors need to know about this. Then follow all the instructions carefully as much as possible. If there's anything that is not clear for you, ask questions. And then do not be afraid to ask questions. This is your health. Your doctor is your partner. So your colleagues, and you should be able to discuss these things without fear or feeling intimidated. So your body is your life. Get involved in your healing, and if you have no one, then remember that it is the way you prepare that will give you the right results. So learn from what you have been told about your surgery, prepare for it, and protect your body always. So share this with someone who you think will be needing to prepare for an upcoming surgery, or a family or a friend. And remember to subscribe to the overall YouTube channel for more tips on what to do during some of the surgical procedures or medical procedures that you might be anticipating to undergo. Remember also to give your comments on the comment sections. What have been your experience either before or during surgery or afterwards? What would you wish that we as the medical profession to know, and also other colleagues or friends to know about surgical preparation? Thank you very much. We meet in the next video. Thank you for watching.